Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to ITV. November being the month of pulmonary hypertension awareness, this campaign has taken South Africa by storm. It's changed social media pages to completely blue. So we're taking the time out today to speak to Dr. Fatima Bhabha to find out more about what pulmonary hypertension is. Assalamu alaikum, Dr. Fatima, and welcome to ITV.
Wa alaikum salam, Zaheerah. Thank you so much for having me. Before we start, I'm just going to say that I am a medical doctor, but not a specialist in pulmonary hypertension. So I'm going to give you the best that I know about the disease, and we're going to try and educate as many people as we possibly can today, inshallah.
Fantastic. I see you've been an active member in the campaign, going around to schools, educating people. How did your role come about in the campaign?
Well, thanks to the Caring Women's Forum, who've taken on the campaign as one of theirs, and being a member there, we've joined the campaign. But apart from that, having met Shakira and Humaira, it's something that I feel we should all be on. We should all take on this campaign, and we should all go out and create awareness. To be honest with you, I didn't think pulmonary hypertension is not something that really crosses our mind, or even anybody's mind for that matter. If you had to think about disease processes, you would think cancer, you think all other terminal diseases, and pulmonary hypertension doesn't feature for some odd reason. And so when we started the campaign with yourself and the Caring Women's Forum, it was something I thought we should all do, because no one knows about it. Nobody knows the prevalence, nobody knows the incidence, nobody knows how many people have it, and nobody actually knows how to deal with someone if they happen to come across a person with pulmonary hypertension.
I think that's an important point, because for myself as well, little information was available. You knew the basics, but couldn't understand exactly what was happening behind the scenes. So that brings me to my first question: is what is pulmonary hypertension?
Okay, so before we get to that question, I'm gonna tell you something as well. Like when I heard pulmonary hypertension, I thought, okay, I know that. I read it somewhere at medical school. I learned it somewhere. Yes. But you don't come across it as often. So what is pulmonary hypertension? So the name in itself gives us the definition. So pulmonary means lungs, and hypertension means an increase in pressure. So pulmonary hypertension is an increase in pressure in your lungs or in your heart. So we're going to break it down. And if we can all think about a heart, and that's the easiest way I think of thinking of it. So you think of a heart, and you break your heart into the right side and the left side. And then you get your lungs. So the blood goes from your heart to your lungs via what we call the pulmonary arteries.
Yes.
Okay. And this takes the blood to the lungs to get oxygen, and then it comes back to the left side of the heart, and from there it goes to the whole body. Now, pulmonary hypertension essentially is this pulmonary artery that's taking blood from the right side to the lungs. It gets narrow. So if you can imagine a little pipe that's like this, it gets smaller and smaller and smaller, and the blood flowing through there, it gets harder and harder for this blood to actually get from your heart to your lungs. So what happens then? If you can imagine someone having a hose pipe and then closing the end of the hose pipe, that pressure that you get behind is the pressure that your heart is now going under.
Okay.
So you're increasing strain on your heart because it's pumping that much harder to get the blood from here to your lungs, to get oxygen, to get to the rest of the body. So that's the simplest way of explaining it. I mean, there's lots of medical terms for all of this, but for the general population, that is the basics. So it's a strain on your heart because your pulmonary arteries are either narrowing, or they're thickening, or they've got an increased pressure that the blood needs to pump against to get to your lungs.
All right. I think, you know, it sums it up really well for all of us, because that's quite a basic explanation of how it works.
Well, that's the most basic explanation.
Yes.
If we had to think about it in medical terms, if you think about your normal blood pressure, so that's the blood pressure in your whole body. So you've got a systolic blood pressure over a diastolic blood pressure. Now, if we had to look at that in the pulmonary arteries, you've got the same thing. So it's called pulmonary artery pressure, which is 30 over 12 normally, generally. And when you have an increase in pulmonary, when you have pulmonary hypertension, that number goes up. Like if you had to have hypertension normally.
Yes.
And that's where they will measure the pressure, is in that artery.
Okay. And then obviously with that, your heart is working extra, your lungs are working extra, taking strain. So when children that we see who look okay, this is often a discussion I've had with Shakira where we've said, you know, people look okay, but nobody understands truly what's going on the inside that causes so much of damage. What are the symptoms that we're looking at that this causes?
Okay. So the basic symptoms, so this is for someone who hasn't been sort of diagnosed or something like that. They will have chronic fatigue, which is not in proportion to someone in their age. So for example, if we had to take a 6-year-old, they could run around all day and they shouldn't be getting short of breath. But if you had to take someone who's got pulmonary hypertension, they will run a short distance and be not tired because they can't move, as in their limbs are sore, but tired as in they don't have enough air. So they are short of breath. They will be like huffing and puffing, as in air hunger. So they're trying to get in more air. Okay, that's one of the biggest sort of symptoms.
Can I just ask you then, is that not often misdiagnosed for asthma at times?
I was actually going to get to that. So a lot of parents then, and even doctors could make that mistake quite easily, also because it's such a rare condition, where you can mistake it for a lower, like a flu, you can mistake it for a lung infection, and most commonly it's mistaken for asthma. But the difference is that they get this shortness of breath and air hunger at any point of exertion. Whereas with asthma, it's exertion, but it's worse at night. Theirs sort of is the same whenever they exert themselves. So that's one of the first ones. The second one they have is what we call syncope. So you will just sort of faint at any time, you know. But what happens with that is that you're feeling the pressure. So what's happening is that your heart's working too much. You're not getting enough circulation going around, and that's why you get the syncope, because you're not getting adequate blood circulation throughout the body. So you'll have dizzy, or well, initially dizzy and then fainting spell. So they will feel lightheaded and then they will faint. A very common one is the blue lips. So if you understood how I explained the pulmonary hypertension, you'll understand why they're getting the blue lips, because you're not getting enough blood to your lungs to get enough oxygen to get it to the rest of your body.
Absolutely.
That's why you have the blue lips.
And that ties in also with the current campaign that we have running on Instagram under PH Kids SA, which is exactly about, like you're saying, the lack of oxygen that's coming in. So it was an attempt to create and make people aware of how children and adults with pulmonary hypertension feel. And we've asked people to paint their lips blue so that they could see and show an awareness and almost solidarity with children who don't get oxygen, and as a result have their lips going blue.
Yes. What else they have is they have, so it's the blue lips, the fainting, the dizziness, and the chronic tiredness. So those are the common ones. They can also have chest pain. They can have, essentially, those are the big ones. I mean, there's lots of other small ones, but those you sort of come in later in the disease, which isn't something that you're going to pick up as a general person.
So what then would be our first port of call? If I was, if one of my children presented with something like that, where would be my first port of call? Would it be to my pediatrician? Would it be to a neurologist? Where would I start?
Okay, so we start at the beginning. The first person you'll go to would be your family GP or someone you know. I mean, most mums nowadays, because of the world we're living in, sort of never go to the GP and they go straight to the pediatrician.
Or Google.
So it's, or Dr. Google. But having said that, Dr. Google is the root of all evils, because you get all sorts of information there and they blow most things out of proportion. But your first port of call, I would say, would be your GP or your pediatrician. But you need to also give them the correct information. So you're going to have to say, because as doctors, yes, we will examine and we will look for whatever we can, but if you can give us as much information as you have, we can put it together and get a good diagnosis. So you need to give them as much information as you can. But also then, pulmonary hypertension on its own. So if we had to say idiopathic pulmonary hypertension, which is a child that is born with pulmonary hypertension, is extremely, extremely rare. It is one in, so before we get to that, we must understand that these are not stats for South Africa. South Africa has no stats for pulmonary hypertension. We have no incidence, no prevalence, no etiology.
Is there a reason behind that?
Very, very uncommon.
Okay.
We see it very rarely. There aren't that many children presenting with pulmonary hypertension, like idiopathic, as in born with pulmonary hypertension.
Yes.
Most of the kids that present with pulmonary hypertension will present at birth, but it's a congenital defect.
So would it be a secondary pulmonary hypertension then?
So it's
Okay.
pulmonary hypertension because of another cause. So
Okay.
they will either have like an ASD or a VSD.
Okay.
So they will have some problem in their heart that needs to be repaired. Hence, the pulmonary hypertension will be better.
Okay, so then that brings me to my question then. If there is a primary problem and the pulmonary hypertension is secondary, can that then be cured if the primary problem is sorted out?
Okay. So that's also a very sensitive topic, because that depends solely on the type of problem that they have,
Okay.
the extent of the problem that they have, and how well it was repaired, and how soon after diagnosis it was repaired.
Okay.
So essentially what they say is that if you leave pulmonary hypertension due to a secondary cause for a long period of time, it's much harder to cure and treat.
Okay.
Whereas if it is treated sooner and quicker, then the results are much better.
All right.
But then also it depends on the post-operative care.
All right. So we'll come back and ask further questions and get more information on pulmonary hypertension. I have no doubt that we're finally getting to understand the disease a little bit better. When we come back, we'll continue with questioning Dr. Bhabha more to understand it a little bit better. We'll be going for a short break. Assalamu alaikum wa rahmatullah. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to our section on ITV on pulmonary hypertension. This being Pulmonary Hypertension Awareness Month, we're very honored to have Dr. Fatima Bhabha in the studio with us. Assalamu alaikum and welcome back.
Wa alaikum salam. Thank you for having me back.
Dr. Fatima, we were busy discussing currently what the status is in the country. Where does that leave us in terms of research that's available for cures, for treatment, things like that?
So when the campaign started, I was very happy, because the research related to pulmonary hypertension in kids is very minimal. Because of the rarity of the disease, there aren't enough people to do research on.
Okay. You mentioned the rarity. What's the current prevalence of pulmonary hypertension in children?
Okay, so like I mentioned before, we have no statistics for South Africa itself, but in the general population, they're saying it's 1 in a million,
Okay.
or thereabout. That's of idiopathic pulmonary hypertension. When you come to the congenital ones, which is the secondary one, it's a lot higher.
Okay.
It's about 2.23% of the general population.
So taking, for example, the founders of this campaign, the Budania family, and having had 3 children in their home with primary pulmonary hypertension, they probably throw the statistics completely off.
Well, they themselves would then be a statistic, because it is in a family where you've got 3 kids with a disease that's supposed to be 1 in 1 million. So that brings their particular stats for their genetic group down. And that's the type of research we need to go down. So we need to see in their family, do they have a gene that's carrying this pulmonary hypertension? Do they have, so in my research that I was doing after the pulmonary hypertension started, that it is 1 to 1.7 males to females.
Okay.
So in children, it's actually almost equal, whereas up until last week, I was under the impression that it was more common in males than females.
Yes.
But doing more and more research, we found that in 2014, there was a paper published, and it states there that it is 1 to 1.7 males to females in kids. But as you get older, in adults, that's when the tables turn. So males are more common than females. The other thing that's quite interesting to know is that it's a dominant gene when it comes to congenital pulmonary hypertension. For idiopathic pulmonary hypertension, they haven't actually They don't know whether it's recessive, dominant, or whatever it is. So in terms of research, we don't really know much.
Yes.
You're basically treating what you find at the time. You can't do sort of preventative measures, whereas you can with other genes to say, look, you've got such and such and such. You are at higher risk of getting a child with pulmonary hypertension, or you've had pulmonary hypertension, or someone in your family has had it, that another person in the family or down the group would have pulmonary hypertension.
All right. So taking into account all that we know at the moment, what are the current medications that are available for children with pulmonary hypertension?
So for children with pulmonary hypertension, there are no registered medications for kids. And the reason being is coming back to the fact that there are such few kids with pulmonary hypertension, there aren't enough subjects to treat on. So they are using medication that are registered for adults because they've researched it so well, and they are basing their doses on an adult medication. Now, in the rest of the world, or in America per se, like Shakira was telling me, there are 12 registered medications that you can use for pulmonary hypertension. In South Africa, I found 2, but it's the same thing. So it's the medicine and the generic of the medication. And that's also for adults, which they are then dosing down or adjusting for kids.
But then obviously your side effects that you're dealing with then are far greater as well, because if it's nothing geared specifically towards children, your side effects should be quite great.
Well, that's the biggest challenge with pulmonary hypertension, is that you're treating a little person with big people medication in simple terms. So you're taking something that would have X, Y, and Z in an adult, and they're getting X, Y, and numerous however else in a little person. So that makes it even harder to treat, because you're not only treating the disease process, you have to combat all the side effects that they're getting from something that's supposed to be benefiting them.
Absolutely.
And that's why we need to create more awareness, because if we can get just one drug company on board to do some sort of research for pulmonary hypertension, that in itself would be such a gain. I mean, yes, it's a few people, but we can make a small difference in someone's life.
Absolutely, and I think it's true that, you know, if you can make a difference in one person's life, that alone is enough. It's helped one person. Dr. Bhabha, in terms of oxygen that's required, because I see very often children with pulmonary hypertension walking around with portable oxygen and the nasal prongs, is that something that they have to constantly have with them, something that they have to constantly be using 24 hours a day? How does that work?
That's a very good question, and we actually forgot that in everything that we've been talking about. So what happens is they're not oxygenating their body adequately, so they need to have either nasal prongs or whatever type of oxygen. The easiest is the nasal prongs. What that does is it supplies the oxygen to the whole body, and therefore decreases the strain on their heart.
Okay.
But now you must understand that pulmonary hypertension has a waxing and waning sort of effect.
Okay.
So the child, for example, could be fine without their oxygen today, and they could do not strenuous activities, but day-to-day sort of things without the oxygen today. But then tomorrow they can't even get out of bed without the oxygen, because it really depends on the strain on the heart and the pressure in the artery at that time.
Okay.
And that, so they could be sitting around watching TV, nothing, and then the next day or the next minute they need oxygen in high doses, because they need to then oxygenate the rest of the body. But that also comes down to oxygen supply and demand, because your body needs excess amount of oxygen under certain circumstances, whereas it needs less oxygen under different circumstances. So if she's not sympathetically in overdrive or stressed or exercising or you know, in a calm state where her medication's working, she may not need oxygen, or he may not need oxygen for a certain period of time, but then they will need to go back to taking the oxygen after a certain period of time.
And I think that's tough. I think that's something we forget, that for a little child to walk around having oxygen with them all the time, having it inside your nose, I know from experience, from a professional point of view, that's very abrasive to the nose, to things around your face. How do parents deal with it? How do families deal with it?
That is, from a professional opinion, it's very difficult. Because, I mean, think about yourself. A person or a child with pulmonary hypertension, if you need to breathe through a straw, that is how they feel every single day of their lives. Not easy. That's the first thing. That's the pressure that they are feeling just to get oxygen into their bodies. And then to have something attached to your nose sort of 24 hours a day that's causing abrasion. It dries out your nasal passages. It's uncomfortable. You need to stick it down with something. And it's almost like being restricted because you can only go as far as your oxygen can take you. You can't really do anything else.
And I think that's the part that I've seen over the past few days, over the past few weeks, has been how limiting it is in terms of just being active, the things that we take for granted, going down a slide, walking to get an ice cream, just jumping around. Those are things, how can we as a general public be more aware or be more sensitive to things like, or help out when we see a situation like this?
That's a very difficult question, because how do you say to a little girl who's sitting outside watching everyone jump, look, you really can't do that, or you need to. I think we need to make our kids more aware, so they will modify their behavior adequately. Absolutely. And we will modify it's not going to be, oh, let's just jump or go play outside. You know, you're going to be more sensitive in how you would approach your kids, and then they would respond to the situation, because kids essentially do what we tell them to do, and
Absolutely.
they behave how we teach them to behave. So if we educate them, and then they will also modify their behavior patterns accordingly.
And I think kids are more open to doing that far more than adults are. We often forget, and it slips our mind. Dr. Bhabha, as we've been talking, we know that obviously there is a prevalence of pulmonary hypertension. There is a diagnosis of it. People do have it. Is there a cure? Not even the treatment options. We've discussed the treatment options. My question is, what is the cure for this disease?
Short of a lung transplant, which is not even guaranteed to be successful, there is no cure for pulmonary hypertension, in my knowledge. And as much as I've been reading and speaking to people, and there is no definitive cure for pulmonary hypertension. And that is what makes the disease very, very difficult. And I know this is not something that we should talk about, but in a person that has congenital pulmonary hypertension, with the reversal of the problem, 2.5 years is what they give you. And that was before they added on the medication. So now with the medications, they're giving you between 4 and 5 years. That's congenital. Now when we come to idiopathic hypertension, they're saying between 1.5 to 2 years.
Okay.
So this is the reality of what we're dealing with. It's something that's really scary. It's very heartbreaking. It needs as much awareness as we can give it. It needs as much research as we can do. And I think we're going to take it upon ourselves to find as many professionals as we can who are willing to give us their time so that we can do something with pulmonary hypertension.
Jazakallah. I think we've summed it up very well with Dr. Bhabha. The fact that there isn't adequate enough research being done in it, the treatments are inadequate at this point for children with pulmonary hypertension. Get out there, raise awareness, find us on Instagram under PH Kids SA, turn social media blue, try and encourage your doctors, the drug companies that you deal with to all put in more efforts, more time, more funding into research. The Quran says that there's a cure for everything except death. Inshallah, they will find a cure for pulmonary hypertension as well and give all